Some got the standard once-a-day pills to fight osteoporosis. Others receive 5-minute intravenous infusions of a Novartis cancer drug called zoledronic acid. The results showed similar improvements in bone density for the women on pills and the women receiving injections, including the once-a-year injection. However, there were far fewer side effects and complications experienced by those in the latter group. The point of treating women for osteoporosis is to protect them from humped backs and easily broken bones. The researchers won't know for another 5 years if the new treatment actually prevents fractures, but a much larger study is being planned to find out. In China, this is often the fate of children whose parents are serving time in jail. Shunned by society and left to fend for themselves, many end up on the streets begging to survive. The social stigma of crime means relatives are often unwilling to care for these children, or are abusive if they do. But one female prison officer decided to help. Defying strong opposition, Zhang Shuxin set up special villages around the country for the abandoned children of prisoners. The villages survive on donations and aim to provide a safe, caring home, while psychological support is available for children who've been traumatized by their experiences. Aged 6 to 14, the children get regular meals and an education. They also have time to do things like picking fruit in nearby fields. Their lives have changed dramatically since coming to the village. There are 3 villages so far, and plans to open others throughout China to give more kids like these a safe haven and a place to call home. Terry and Laura look alike. They could be biological mother and daughter, but the 11-and-a-half-month-old is adopted. Marta was her name at the orphanage in Kazakhstan, where this video of her at 2 months old was taken. Marta had many serious health concerns, ranging from rickets to hypertension, so Terry and her husband Michael sought the help of Dr. Kate Cronin of the DuPont Hospital in Delaware. Doctors use the videotape to check for any physiological and behavioral problems, but most countries don't provide videos, so decisions must be based on medical records and still photographs, and better yet, a discussion with the medical staff at the orphanage. Dr. Cronin's phone call revealed that many of Laura's health problems were misdiagnosed, but she still requested an updated video and advised Terry and Michael to take their time. The baby's eye contact was strong and she was holding her head up, but at 5 months old, she still wasn't babbling. Nevertheless, Terry and Michael traveled to Kazakhstan for their daughter. With her new parents' love and care, Laura was rolling over within 3 days and sitting up on her own within a month and a half. Since last seeing Laura via video, Dr. Cronin has witnessed a remarkable turnaround. She's crawling, standing, babbling, and doing all the other things a typical 11-month-old would do. Today, little Nora's a healthy handful, bringing her parents great joy. In sadder news, the continuing saga of sexual abuse carried out by Catholic priests against young boys is becoming the largest sex scandal in church history. The frenzy began when Boston priest Father John Geoghegan was sentenced to 10 years on sexual abuse charges for molesting more than 130 children over 30 years. Psychiatrist Dr. Norman Rosenthal believes that damage done from sexual abuse can be lifelong because it involves violating boundaries of trust. Whether the abuse is carried out by a priest or family member, the damage is intensified because the abuse is hidden. For that reason, Rosenthal believes that it can be healthy for sexually abused people to come forward, even as adults, to confront their abusers, just as Mark Serrano did, charging he was molested by a priest beginning at age 9. To Serrano, the priest and church were one. Rosenthal outlines the physiological changes in the brain that occur after abuse in his book, The Emotional Revolution. But he's quick to point out that with the right help, it's never too late to overcome even the most painful past. In related news, the UN estimates that last year alone, almost 13 million people were on the move, among them 700,000 children being trafficked for sex. The Philippines' port of Manila sees up to 500,000 poverty-stricken women and children every year. This young woman was one of the thousands of teenagers who were drugged and sold for sex. But it's not just in Asia. In Nicaragua, this young girl is being prepared for a night's work. In Europe, Albanian children are trafficked into Greece, many sold by their parents. And in Sierra Leone, thousands of children have been abducted and raped by militia. The UN is fighting back with education like this school in India, which tries to provide schooling to the very young, hopefully to give them a chance later in life. But it's a lucrative trade, and the UN is sometimes forced to even fight the battle with governments, all too keen to turn a blind eye to this profitable form of abuse. It often has no symptoms and there's no known cure, but this genetic heart condition can claim a young life in an instant. 15-year-old Colin Dolder has had hypertrophic cardiomyopathy, or HCM, for 3 years. It's a disease that causes the heart's main chamber to enlarge, making it vulnerable to life-threatening rhythm abnormalities. Dr. Barry Marin of the Minneapolis Heart Institute is trying to raise awareness of the disease that affects 1 in 500 people. He also discovered that hypertrophic cardiomyopathy is the leading cause of sudden death among young people and even among trained athletes. Only an echocardiogram can give complete pictures of the heart, showing problems that would normally be missed. While some HCM patients live normal lifespans without symptoms, the disorder can cause death or disability, especially among those who put extra strain on their hearts. Colin's mum, Connie, was shocked that not only was her son sick, but he had a relatively common disease that few people had ever heard of. In some cases, a heart transplant is the only option for HCM patients. Others can be treated with medication or implantable devices. When a heart stops, a race against time begins. Paramedics struggle to keep the victim alive long enough to get to a hospital. But with a survival rate of 5% or less, the odds are stacked massively against them. A recently published study shows that a drug called amiodarone can double the patient's chances of getting to the hospital alive. When a person goes into cardiac arrest, the first response is cardiopulmonary resuscitation, then defibrillation. But if by the third electric shock the heart hasn't returned to a regular beat, the standard procedure is to inject the drug lidocaine. While amiodarone has more chance of getting a patient to hospital alive than lidocaine, it's harder to administer, with the paramedics having to prepare an IV on site. And even if a patient does make it to the emergency room, amiodarone doesn't raise their chances of getting out alive. Another study in the New England Journal of Medicine has shown that ice packs used to chill the bodies of cardiac arrest victims will dramatically reduce neurological damage from stroke. Scientists are advising that ambulances should carry ice packs to be placed on a patient's body immediately. Applied in time, the cooling can improve their chances of surviving with little or no neurological damage. The findings from Australian and European researchers in 2 separate studies offer an inexpensive new tool to help the millions of people who suffer cardiac arrest worldwide. While CPR or a defibrillator can restart the heart, a series of brain-damaging chemical reactions may have already started if too much time had elapsed. Doctors at Duke University Hospital in North Carolina have already noted many positive effects of the cooling technique. If the heart stops beating for more than 5 minutes, brain damage or death is very likely. But lowering the body temperature to 92 degrees Fahrenheit, 6 degrees below normal, is considered the optimum temperature. Of the 1.1 million American heart attack victims each year, only about 20% get to the hospital in time to benefit from the latest clot-busting medication. non-invasive, prevention, implantable. These were the buzzwords at a recent meeting of the top minds in cardiac care. Among the advancements in the research into the world's biggest killer, heart disease, is a new drug-coated stent that's proven 100% effective. Surgeons can now combine balloon angioplasty with stainless steel stents to prop arteries open. But the body builds scar tissue around the stents, causing it to reclog, a process called restenosis. The new stents stop this from occurring. The drug-coated stent is not approved by the FDA yet. Researchers are still working on ensuring that the drug coating is not rejected by the body. Another bit of high-tech help for the heart is a combination defibrillator and pacemaker in one. Research on the FDA-approved InSync shows positive results. These patients have faulty wiring in their hearts that causes abnormal rhythm. The condition is usually fatal within 5 years of diagnosis. The InSync not only regulates the heart's rhythm, it also shocks the heart if it beats irregularly. Studies showed that those with it survived longer and had a better quality of life. Japan's snow monkeys have known for ages the joys of a hot outdoor bath in the middle of a cold winter's day. But now people from across the globe are discovering the same pleasure in Iceland. The Blue Lagoon is an outdoor spa created from the runoff of a geothermal power plant. Never mind that the temperature outside is below freezing, the warm waters in the lagoon average a comfortable 100 degrees Fahrenheit. But these waters offer more than a pleasant excursion on a cold day. The lagoon's mineral content is known to cure common skin ailments like eczema and psoriasis. According to scientists, the unique ecosystem of blue-green algae and silica mud coupled with the location's unpolluted surroundings form the treatment's foundation. The medicinal attributes of the water were discovered by chance. Today, the lagoon runs a skin therapy outpatient clinic. Treatment for psoriasis takes about 4 weeks. The cost for Icelanders is covered under the country's national health insurance. The price for foreigners depends on the length of their treatment. A daily visit, excluding special treatments, costs about $80. However, most of the people who arrive at this oasis don't come for treatments, but rather to be treated to an afternoon of relaxation. There's nothing like it. That relaxed feeling is shared by many. Last year, 315,000 people visited the lagoon, more than the entire population of Iceland. In the South Pacific, where it's grown, kava is considered the drink of the gods. The root can help people relax, de-stress, and ease pain. James Adelson has used the kava that he sells in his New York City store to deal with anxiety. But kava is coming under increasing scrutiny by regulators in the Western world, where researchers have linked the herbal remedy to over 24 cases of hepatotoxicity or sick liver condition. Several people have needed liver transplants, and one person died after using it. Dr. Roberta Lee, the medical director at the Center for Health and Healing at Beth Israel Medical Center in New York, has studied kava extensively. She believes the problems arise when it's processed into capsule or liquid form. Already Australia, the United States, Canada and some European countries are warning people about kava. Kava products have been withdrawn from many store shelves in the UK. The Swiss have banned them and the German government is considering making them prescription only. According to Dr. Lee, this action may be slightly hasty, considering the side effects of kava are as dangerous as those from prescription anti-anxiety drugs. Locals in this small northern Nicaraguan community picked the small flat leaves from the tamarindo tree for their medicinal value. The popular remedy known as fresco de tamarindo is said to cure disorders like inflammation and digestive problems. A native to tropical Africa, the tree spread to the tropical areas of the Americas and West Indies. First, the leaves are ground into a fine pulp. Then they're steeped to release the plant's medicinal properties. After the leaves are strained, The juice is ready to drink. It can be used to treat fevers and as a gargle for sore throats too. The pulp, which is dried and packaged, can also be sprinkled into food, as it's known to help those suffering from stomach upsets. Locals swear by the medicinal properties of the tamarindo tree and say it's as effective as Western drugs, which are either unavailable or out of the financial reach of most of the residents of this small community.